So I've got Katie with me today. She's in for a full face rejuvenation. So before we inject, we've had a talk about risks and side effects, what she can expect from treatment, limitations to treatment. Luckily for Katie, she's just been very hard on herself. So there's not too many limits to what we can achieve today. And we've looked at the shadows on her face. So starting from the top down is how I do my assessment. And her forehead's beautiful. She has a little bit of Botox anyway, and that's doing a great job. Everything's lovely and smooth and hydrated. Moving down into the temple region, we actually haven't got much volume loss here. Nothing at all really. So I'm quite happy to leave those be. And then into the mid-face. Now in the mid-face, you can quite often use at least 6mm on its own just in the mid-face to rejuvenate the apple of the cheek in somebody that's a little bit older or lost a little bit more fat pad. In Katie, we won't need to do that today. I think looking at her fat pads in the mid-face, we've got slight room for improvement. She has already had a little bit of filler in the past here. So potentially an extra 0.5mm just into that, the apple of her cheek to lift the ligament and support the fat pad. A little bit up the contour of her cheek, up the zygomatic arch, just to give some lift to the lateral cheek. Because if we look at Katie from the front, I'm being brutal for the sake of the video, she's got really, really strong masses of muscles. So when she clenches, if you clench for me, they bulge out slightly. And what we would ideally like to achieve is a higher cheekbone and a slimmer jawline. She's got a beautiful bone structure underneath that strong masses of muscle. So we're going to knock that muscle out with a little bit of Botox and accentuate the cheekbone with some dermal filler. Moving lower down the face, looking at the smile lines, I think once we've achieved the mid-face rejuvenation, there won't be too much more work to do here, but a slight bit of filler into the deep nasolabial fold, just to soften that further, and a touch around the marionettes to lift the corners of the mouth will be necessary. We have discussed lip filler today, haven't we? And we're going to look at achieving a hydrated look with her lips. Nothing too big, just a little bit of definition and some hydration with 0.5mm of special lips Vivacy. So once we've looked at the shadows and the areas of deficit in a patient's face at consultation, we then need to contemplate the anatomy of that person. And we all are aware of our textbook anatomy, but not everybody follows the same patterns. In the mid-face, you have a foramen just around about here. Can you feel that? I feel a bit sensitive. And it's a little hole that the infraorbital artery pops out of and feeds into. So anything past the mid-pupillary line, for me, is a no-go area. We don't inject there, certainly not to the bone, through fear of penetrating that artery and that little hole in the skull. We've got just along the zygomatic arch, your transverse and your zygomatic arteries. They run roughly parallel to each other, textbook would say. But it's always good just to palpate and have a feel for those if you are injecting up the lateral cheekbone. If you hit one, you'll cause a stinking bruise at best. Feel yours really well. Just roughly a finger's width in front of the masseter muscle is a small notch in the skull. You can usually feel it with your finger, and that is roughly where the facial artery sits, deep onto the bone, and that makes its way very scattery up into close to the nasolabial fold, and then that finds its way and links to the angular artery that feeds the top of the face. Off of this facial artery, we've got your superior and your inferior labial arteries that are responsible for the blood supply to your lip tissue, and feeding from the superior labial artery, you've got your columellar arteries that are responsible for the blood supply to the tip of your nose. This is very, very basic anatomy, but it's to give you an awareness of the fact that the arteries are a roadmap, and one blocked vessel in the lip can potentially cause problems lower down in the cheek, in the tip of the nose, the top of the nose, and potentially cause blindness as well. So when you are injecting, please know your anatomy and be aware of your vessel patterns. When we're treating cheek volume and we want to gain lift and projection, I would always opt for a volumizing filler. In this case, it's Vivacy Stellage XL. I will only be using 1 ml split between both sides of the cheeks. And then to achieve the contour in the cheek, we want something that's not quite as hydrophilic. We don't want it to draw in as much water. So we will be opting for XXL. If you just bring your head towards me. So my preferred injection technique is needle over cannula usually. I appreciate that there is some evidence to suggest that cannula is safer, but I find that a needle is more precise. Your first injection's coming up, lovely. You okay? Mm-hmm. Little scratch. Well done. You okay? Mm-hmm. So it's important to aspirate on your injections. A good aspiration will take you about 10 seconds, and it's just a safety net to prevent any occlusion and make sure you're not sat in a vessel. You all right? Mm-hmm. Well done. Fab. Look straight ahead for me. Brilliant. Just bring your head this way for me. Thank you. And we're just going to repeat very similarly on the other side. Is that okay? Mm-hmm. Brilliant. And look straight ahead for me. Just do a smile for me. And relax. So the reason I asked Katie to smile after injection is to check that the filler isn't interfering with the natural muscle movement. And the last thing we want to do is cause a muscle to become stiff in its movement because of where we've placed the filler. So the overall goal is to achieve a really natural result, and that needs to be natural on movement as well as resting. Does that feel okay? Okay, just another injection at this side, lovely. Well done. Well done. So moving down to the nasolabial folds, we're treating softer tissue, so we need a softer filler to move with the muscle. So this time we're going to opt for L, Stellage L. It's got a slightly, it's slightly more elastic and less viscous, so it just moves a little bit better with the muscle. We've put 0.1 down to burn in the deep nasolabial fold, and we'll be just coming along, following that line. There are a few different techniques you can use here. For today, we're going to just use a linear thread. You can use the fern technique, which involves placing very tiny threads this way across the crease. But for today, we'll be placing 0.1 linear threads in the direction of the crease. Are you ready, honey? Mm-hmm. So similar again, little scratch. Well done. Always check your depth. And we want to be in the deep, fatty tissue. Well done. And another one. And the same on this side, honey. Well done. Just do a smile for me and relax. Lovely. So in total in the nasolabial folds, we've used 0.7 of a mil, so not very much at all. 0.4 of that was used on the right side and 0.3 on the left side, purely because the deficit's slightly bigger on this side. So following the natural contour of the zygomatic burn, because we don't want to make Katie look any different, we just want her to look lifted and fresh. I'll place 3 boluses on the zygomatic eminence, which is this curvature in the burn here. Very evenly, 0.1 in each injection site. So we've got first injection, honey. Mm-hmm. You all right? Yeah. And second. And last one. Feel like a pincushion when we're finished. Well done. Look at me, big smile and relax. Great. I'm going to repeat similarly on this side. Little scratch. Well done. Feeling all right?
Yeah.
Been absolutely amazing. The tingling in your top lip stopped.
Yeah.
Good. So moving down again, we're now going to concentrate on the marionette region of Casey's face. She's actually got a really lovely, strong, sharp jawline. So treating the jaw is not going to achieve too much pullback or lift. It is just a simple drop in the ligament around her mouth and a bit of a loss in fat pad in this area. So we're just going to replace the volume of the fat pad that's lost and support the ligament to retain the corners of the mouth and keep some lift. Are you ready?
Yep.
Awesome. Okay, rest your mouth open for me. I should say I'm using Stillage M, which is softer still, because there isn't a lot of tissue around the mouth. It's quite thin and we don't want it to look bulky or uncomfortable as she talks. So if you pick up the corner of the mouth and then enter with your needle and aim to have your needle pick up the base vermilion border and then leave a sweep of 0.1, you'll automatically start to get some lift in the corner of the mouth. For further added lift, bring your needle 1 millimetre along from your last injection point and repeat the same process. And then just to mop up the remaining small shadow that's there, we're going to do some cross-hatching. So this just involves very small linear threads into the superficial fat pad, vertically and then horizontally to create a support structure for the corner of the mouth. That looks really nice. Really happy with that. So a little scratch again. Well done. And another one. Sounds like a happy child outside. Just get inside your mouth again. Thank you. Just with the 0.2 of M that I've got left, Katie's got a very, very slight mental crease. Not enough to concern me earlier, but as we've got a little bit of filler left and we can rejuvenate that area, I'm going to. Is that okay?
Yeah.
Super. So it'll be a bit of a nippy injection. Little scratch on A. Fab. Well done. Well done. Just check inside your mouth. So when we inject the mental crease, you've got 2 more foramens that sit either side, and the vessel comes out of them this way. So we would only inject to the midline from each side just to avoid penetrating the vessel at the opposite side. And I think it's important that you always just check inside the patient's mouth, into the mucosa of the mouth, to make sure that you've not injected too superficially at the other side and caused any problems inside of the mouth. Do you feel okay? Yeah. You're doing so well. So we're going to move on to your tear troughs. This is a little bit of a different sensation because we're using a cannula. You'll feel a sharp scratch to start with and then a bit of pressure as I push through. It's not painful, it's just uncomfortable. If you feel a sharp pain, tell me. I'm sure you will anyway. And then I can just reposition. It just means I'm sitting against a nerve.
Right.
It won't cause you any damage, any problems. It's just painful.
Right.
So I don't want to be.
All right. Okay.
All right. So when we're treating the tear trough region, we need to be confident that the skin in the area is lax enough to cope with the filler that we're going to place there. We need to ensure that it is a true deficit, that they're not naturally puffy, that there isn't a bulging fat pad, and they don't have any natural festoons, which are the little gatherings of fluid that you sometimes see at the lateral cheek just below the tear trough. Katie doesn't have any of that, which is fabulous. This is one treatment that I tend to always do with a cannula. It's not my preferred way of injecting, but I find with tear troughs you just get better placement of filler and it is slightly safer and makes for less downtime for your patient. So are you ready, honey? Little scratch. Make sure you make your life easy when you treat a tear trough or you use a cannula. Leave the insertion needle in just for a few seconds and give it a wiggle around. So it's really important to massage your patient's lips after you have injected. We don't send our patients home with instructions to massage, just in case they do it with unclean hands and they cause an infection, or they manage to move the filler into the wrong place. I think it's unfair to place that responsibility on your patient. Excuse me. If you can just run your tongue around the inside of your mouth, can you feel any lumpy, bumpy bits that are bigger than a pea?
No.
No, fantastic. So that's Katie's full face rejuvenation with filler finished. After the filming, we will add a little bit of Botox just to the muscles, and she'll feel the effects of that in about 2 weeks' time. But to summarise, we've treated her tear troughs with 0.5 mil of dermal filler. She's had roughly 0.7 mil altogether across her mid-cheek and lateral cheek either side. We've split 1 mil of dermal filler between her nasolabial folds and a mil between her marionettes. And then 0.8 mil of dermal filler into her lip tissue just to give them a little bit of life and hydration. I think she's really happy. I'm very happy with the results today. And we do review all of our patients when they come in for a full face rejuvenation, just to make sure that everything settles symmetrically. Nothing needs any small tweaks. 9 times out of 10, everything's fine, but 1 in 10 will need a small tweak, and we do that free of charge because they've spent a lot of money with us, and it's the least we can do, really.